I did mention that it was 120 over 80 millimeters of mercury. There are other values that you might even hear from your doctor or read, which are, for example, 140 over 90. And that is, I have to explain why we use that number. First of all, as you see, I have the check mark, the green check mark in 120 over 80, because that is the normal blood pressure. That is the highest you should have it, no matter if you're 18 or 50. But we've discovered that all of us will start, I mean, our blood pressures will start rising with age. So we have put some other values that are acceptable, and I'm going to explain that. If you are diabetic, you have chronic kidney disease, and you are under 60, we start treating high blood pressure with the value of 140 over 90 millimeters of mercury. But that doesn't mean that if you have, that doesn't mean that 140 over 90 it's normal. That means we are just gonna start medications in that value, but normal is still 120 over 80. And if you are 60 or older, we start medications for, when you have 150 over 90. Again, that doesn't mean 150 over 90, it's the normal. It just means that we start medications at that time. So you might ask, what if I am 60 and I have 140 over 90? Well, if you're 60, you should be 120 over 80 as everyone else, but you have not reached the blood pressure that we start medications. So that means you should start reducing your salt intake, your sodium intake, increasing your potassium intake, doing exercise more regularly, and then we'll see if those strategies work. And if you reach the 100 over 50, over 90, we're gonna start medications on you. But the normal, it's always gonna be 120 over 80. And I want to explain this because a lot of patients, since they're not getting treatment because they have 140 over 90, they think that's the normal, but it's not. It's always 120 over 80. That's what it should be. If you have a value that's higher than that, you should start taking action. Not necessarily medication. Of course, you have to go to your doctor, but you have to start changing your lifestyle.